What term do you prefer? Aboriginal, Torres Strait Islander, Indigenous or First Nations people? Or something different altogether?
I prefer the term Aboriginal.
I'd say the Yahtzee, like Aboriginal Torres Strait Islander.
My preference, and this is a personal preference, is to be classed as a First Nation person.
Yeah, that's the same with me. Anyone can be called Indigenous.
The Indigenous and Aboriginal Torres Strait Islander, like I don't really label myself at all, but there's nothing, like I don't have a specific, it's just I'm happy with both those.
Yeah.
I'm never scared to tell someone that's not, you can't say that.
What is the best thing a doctor could do when engaging with Aboriginal or Torres Strait Islander patients?
And try and break down the barrier and make them feel comfortable. Just don't go straight into it. Spend a little bit of time talking to them and just, being a bit more friendly to break the ice.
I would first of all like to be treated exactly the same as anybody that isn't Aboriginal or Torres Strait Islander, but then also I expect them to have all this depth of understanding about my culture and not offend me. I've got a really high standard for our doctors.
They should be culturally aware of what's happening within that community is another thing as well.
We don't want much from them, do we? They need to know.
Just want them to get us better, get us well.
Train all those years and
making sure we're treated with respect and dignity.
yeah.
Would you prefer that your GP speaks with you in simple to understand terms, or would you find this patronising? I feel like if you use simple terms, it sometimes helps break it down for people who don't understand.
Explain it.
But to use some medical terms, I think it would be good because you can broaden your knowledge a bit more.
The more simpler the terms, the better for you. You want your patient to understand what you're talking about. I know that sometimes you can't get away from those big words in the medical dictionaries and whatever, but I think simple saying, look, this is what you got wrong with you.
Sometimes people might not understand what hypertension is, whereas they break it down, you have high blood pressure or stuff like that. So, keep it simple and not as clinical, I guess.
Yeah, I agree. I think especially in the first instance, having it simple and then building that health literacy around that. Like we get a lot of patients come out, my sugars are great today. Whereas some people, you go, my sugars, and they go, what are you talking about? But if they maybe look at it as something different. So I think definitely keep it simple and build health literacy on that.
Yeah.
Can you tell us about an experience you or family community member had with a hospital, good or bad? This one hurts, I think. Just recently we had an experience with the hospital where an elder in our community and a patient that has been a patient of cover for a long time was in ICU, and family come in and they actually excluded them from using the family tea room in ICU because they were too large. There was like 20 or more people, and he died a couple of days later, and their family missed out on having that time with them. So,
it was a sad time.
It was horrible.
How they were treated.
Yeah.
What we did, you have that emotion, and we just pulled together. We went out, we bought food, we made sandwiches for them, just to try and make them comfortable for where they were getting excluded, because they were a big family and they all wanted to be there by with their father, their dying father. It was very sad.
Took an esky up. We had a kettle there for them so that they could have a cuppa together and sit down and just remember, it's a horrible story, but a good thing that come out of it. Family comes first, and that's what it's all about.
And that's the thing with Murray's family first, first and foremost. It was unreal. And he was a beautiful old man. He was a beautiful man.
Yep.
Yeah. You got the heartstrings working there.